Hello, everyone. Thank you for listening to our CE session titled Preparing Your Pharmacy for COVID-19 Testing. I'm Dr. Jenny Bacci, Assistant Professor at the University of Washington School of Pharmacy.
And I am Dr. Parth Shah, Assistant Professor at the Fred Hutchinson Cancer Research Center. Our hope with the CE is to provide you with an overview of COVID-19 tests and recommendations and guide you through the key considerations you should be thinking about when implementing a COVID-19 testing program in your pharmacy. Before we dive into the webinar, Jenny and I wanted to note our disclosures. Both of us have the following financial relationships for research and work displayed on this slide. Also, please note, we will not be discussing off-label use or investigational use of any medical products in our presentation. We have 4 objectives for the CE. By the end of this program, you should be able to compare and contrast the types of COVID-19 tests, describe the current recommendations for who should get COVID-19 testing, identify COVID-19 testing opportunities in community pharmacies, and summarize strategies for implementing COVID-19 testing in community pharmacies. As you can see from our objectives, we aim to help your pharmacy become better prepared to offer COVID-19 testing to your communities and help mitigate this pandemic. As such, we will not be spending any time talking about the pathophysiology of SARS-CoV-2, COVID-19 disease, and treatment considerations. Another thing to keep in mind is that the information we're presenting in the CE is current as of recording on October 19th. Since we are learning new information about COVID-19 on a regular basis, practice recommendations may change to reflect current evidence. At the end of our presentation, we provide several resources to keep you up to date with current evidence and best practices. So without further ado, let's start with the first section where we will go over the different types of COVID-19 tests. There are a variety of tests out there that patients can use, but they boil down to 2 categories. The first category of tests are for identifying current infections. These tests are designed to detect if a person has an active SARS-CoV-2 infection. In this category, there are 2 subcategories of tests called molecular tests and antigen tests. The second category of tests are for identifying past infections. These tests are designed to detect if a person has antibodies developed in response to SARS-CoV-2 infection. We'll take a moment to dive into more detail about each of these tests. The first test we'll take a more detailed look at are molecular tests. You may know them by a variety of other names, such as diagnostic test, PCR test, or RNA test. These tests look for genetic material that matches SARS-CoV-2. These diagnostic tests are considered the most sensitive for detecting any active infection, and the results are highly accurate. The majority of these molecular tests collect samples via a nasal or throat swab. However, there are a few tests that also take saliva samples. During the shipping process of the samples, most molecular test swabs must be kept within a certain temperature range so that tests will be accurate. The sample also needs to be sent to a lab within a short period of time of collection. In some instances, test results can be returned to patients within a day, but what is more typical is a turnaround time of a few days depending on the laboratory analyzing the sample. As mentioned, these tests are diagnostic, so a positive result can mean an active coronavirus infection. However, since the test is looking for viral genetic material, it can't tell if a person has been previously infected by coronavirus. The second subtype of tests that looks for current infections are called antigen tests. These tests can be referred to as rapid diagnostic tests, but are more routinely used for screening rather than diagnosis. These tests are different from the RNA or PCR test in the previous slide, as they are looking for specific viral proteins on the surface of the virus. Samples from this test are typically taken by a nasal or throat swab, and results can be returned in an hour or less, making them ideal for point-of-care testing. They also tend to be cheaper to implement, as they don't require a laboratory to analyze samples. However, it is important to note that while these tests are highly sensitive, meaning that a positive result usually accurately indicates an active coronavirus infection, antigen tests do not have as good specificity as PCR tests do, which means that negative test results may need to be confirmed with a follow-up PCR test. So said in another way, antigen tests can miss an active coronavirus infection compared to molecular tests. Now this takes us to the second category of COVID-19 tests that look at past infections. These tests are typically called antibody or serological tests. As previously stated, the test looks for whether a person has antibodies that were in response to a previous SARS-CoV-2 infection. Like antigen tests, certain antibody tests can be point of care and usually are able to return results the same day. Antibody tests are different from the previous ones we talked about, in that you most usually require a blood sample, either by finger stick or venous blood draw. Since we currently do not have evidence that a person will have long-term immunity after being infected by SARS-CoV-2, a positive antibody test result does not mean a patient is immune to SARS-CoV-2. If your pharmacy decides to provide antibody testing, it is important that you, as the pharmacist, counsel patients on this point and reinforce best self-care practices, like wearing a face mask and maintaining social distancing. Let's summarize some of the pros and cons of each of the types of tests available. It's important to weigh options among the different testing options, as they require different resources and provide patients with different information that is important to counsel on. With molecular or PCR tests, the main pro is that it is more accurate than the other available tests. The main drawback or con to molecular tests is that they aren't as fast with reporting test results as the other types. They also can't tell if a patient has been previously infected with coronavirus. With antigen tests, the main benefit or pro is that it is faster in getting results than molecular or PCR tests. However, an important drawback is that this test is not as accurate as molecular tests, and people who have negative test results may still have an active infection that was not detected. As such, some healthcare providers may end up ordering a subsequent diagnostic PCR test. Similar to the molecular test, antigen tests can't tell if a patient had previously been infected by coronavirus. Our last category of tests is the antibody or serological test. The pro with this test is that it will tell if a patient had been previously infected with coronavirus in the past. However, the test cannot tell patients if they have an active infection. Equally important, another drawback about this test is that it's best used after a person has been infected, preferably after 2 weeks. It therefore cannot be used to assess an early detection. One last thing to say about testing are that there are now a variety of ways patients can get COVID-19 tests. We talked about laboratory-based and rapid point-of-care tests. Newer tests that have come out include at-home collection tests, which requires a prescription, as well as saliva tests, which some patients may find more comfortable and easier to use than the nasal or throat swab specimen collection.
Now that we have talked about the types of tests, let's talk about the current Centers for Disease Control and Prevention's recommendations for who should be tested. The first set of recommendations are for who should be tested for current infection. The first group of individuals who should be tested for current infection are individuals who are experiencing symptoms of COVID-19. COVID-19 symptoms typically develop 2 to 14 days after exposure to the virus and include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Individuals who have been in close contact with someone with confirmed COVID-19 should also be tested for current infection. For COVID-19, a close contact is anyone who is within 6 feet of an infected person for at least 15 minutes. These individuals should be tested to help prevent asymptomatic and pre-symptomatic transmission. An infected person can spread COVID-19 starting 48 hours before they begin experiencing symptoms or when a test will be positive. The last group of individuals who should be tested for current infection are individuals who are referred to get testing by their healthcare provider, local or state health department. This group includes critical infrastructure personnel, healthcare workers, or first responders who may need to get tested per state, local, or employer guidelines. A test-based strategy is no longer recommended to determine when an individual with a SARS-CoV-2 infection is no longer infectious, except for rare situations. Most individuals who test positive do not need a follow-up test to return to work or school as long as they did not require hospitalization and it has been at least 10 days after symptom onset and they have been fever-free for at least 24 hours without the use of antipyretics. There are also recommendations from the Centers for Disease Control and Prevention on who should be tested for past infection via an antibody test. These tests should not be used to determine if an individual is immune to SARS-CoV-2 as part of routine clinical practice at this time. Antibody tests do currently have limited utility in diagnosing SARS-CoV-2 infection. It's important to note that the Food and Drug Administration has not currently authorized using antibody tests to diagnose SARS-CoV-2 infection, and the Centers for Disease Control and Prevention does not currently recommend using an antibody test as the sole basis for diagnosis of infection. In certain situations, an antibody test may be used in conjunction with viral detection testing to support clinical assessment. These situations include individuals who present late in their illness. For individuals who present 9 to 14 days after illness onset, antibody testing may be offered in addition to a viral detection test because during this time period, the sensitivity or a test's ability to detect true positives is decreasing for tests for current infection, and the sensitivity of tests for past infection is increasing. It also includes individuals who are suspected to have a post-infectious syndrome caused by SARS-CoV-2 infection, such as multi-system inflammatory response in children.
In the first two sections of the CE, we oriented you to the types of tests you can use in the pharmacy and current testing guidelines or recommendations. For the second half of the CE, we will go over two kinds of testing programs your pharmacy can participate in and important steps to consider when implementing a testing program in your pharmacy. So let's dive into the testing opportunities. In this section, I will go over two testing programs your pharmacy may want to participate in. The first set of testing opportunities your pharmacy could participate in are federal programs that are managed by the U.S. Department of Health and Human Services. HHS has partnered with several large pharmacy chains as well as group purchasing organizations that work with independent pharmacies to provide testing to communities. The federal programs use self-administered nasal swabs that a patient would do themselves and then provide the sample to the pharmacy. The pharmacy would then mail the sample to a contracted lab, and results are returned directly to the patient within 3 to 5 business days. The pharmacy does not receive the results directly. In Washington State, independent pharmacies that are a part of the listed group purchasing organizations, Health Mart, True North, and Topco, have access to this federal testing program. Also in Washington State, Rite Aid and Walgreens are the main pharmacy chains that are participating in this federal program. To get a quick glimpse of what the federal program looks like from a patient perspective, you can go to www.doineedacovid19test.com. There, a person can register for a COVID-19 test and get their test results. I've highlighted in the red box the current independent pharmacies listed in Washington State that are participating in the HHS COVID-19 testing program. The second program we wanted to share is one currently being developed by the Washington State Department of Health in partnership with WSPA and will begin piloting in community pharmacies across the state in the upcoming weeks. The Department of Health will work with community pharmacies to deploy two types of tests, a molecular PCR test through specimen collection and send-off, and point-of-care rapid antigen test. DOH will provide the necessary testing equipment to the pharmacies and will allow pharmacies to charge a small administration fee. This program also has certain features accessible to pharmacy staff to ease workflow, like access to online scheduling and test result reporting. Since the program is currently being developed, it will evolve in the upcoming months. But if you and your pharmacy would be interested in participating in this program, please contact Dr. Jenny Arnold at WSPA. As a complement to the newly developing state COVID-19 testing program, we also wanted to share with you another way your pharmacy can be involved with testing your local community. If you aren't already aware, Washington has a statewide Local Health Jurisdiction Memorandum of Understanding, or MOU. This MOU is a partnership between LHJs and community pharmacies to respond to public health emergencies like the current pandemic. The MOU was created in response to the H1N1 pandemic as a way for community pharmacies to work more closely with local and state public health officials and mobilizing resources in the event of a public health incident. The MOU and its accompanying operation plan provide guidance for how pharmacies can work with the LHJs and the state to address a local public health need, like testing or vaccination. We view the MOU as part of the larger public health apparatus in the state that gives pharmacies a tangible way to be involved with their local community's health and safety. If your pharmacy would like to participate in the MOU, please contact Jenny Arnold at WSPA, who acts as the MOU liaison between the LHJs and community pharmacies.
All right, now that we've laid the foundation, let's get to the good stuff. That is, all the things you need to think about in order to successfully implement COVID-19 testing at your pharmacy. We've provided a supplementary handout that summarizes what we are going to spend the remainder of the presentation discussing. Now would be a great time to pull that up and have it open to take notes as we discuss the details and specifics of each implementation consideration. What we will be sharing is a compilation from national resources like the American Pharmacists Association and National Community Pharmacists Association. It also includes information that Parth, Jenny Arnold, and I have learned over the past few months as we have engaged with community pharmacies, the local health jurisdictions, and the Washington State Department of Health. Therefore, where possible, we've customized the information we are sharing to be specific to Washington State. We are also going to be focusing our comments in the context of testing for current infections, as widespread antibody testing is not currently recommended. The first step is to complete a needs assessment to determine whether there is a need for additional access to COVID-19 testing in your community. To determine if there is a need, you should consider disease prevalence, specifically the percent of positive COVID-19 tests. Washington State has a goal of less than 2% of total COVID-19 tests being positive. You will also want to consider local resources, specifically whether your county is meeting its testing goal. The Department of Health has shared that no county in the state has yet achieved its testing goal in terms of the number of tests that are able to be administered per day. This means there is a need in all counties across the state. Specific priority counties are currently Chelan, Grays Harbor, Pierce, and Spokane counties. This may change as time progresses due to outbreaks or changes in testing capacity. You can find the most up-to-date information on the percent positive COVID-19 tests and testing capacity for your area on the Washington State COVID-19 dashboard. The websites are provided on the slide. Alternatively, you could reach out to your local health jurisdiction. You may also consider reaching out to local partners such as schools and employers in your area who may have a need to increase access to testing for students or employees. Once you have identified that there is a need in your community, you will then need to determine what type of test you intend to offer. Specifically, will you offer specimen collection in partnership with a CLIA-certified high or moderate complexity laboratory, point-of-care antigen testing authorized by the Food and Drug Administration under an emergency use authorization for patient care test settings, or home test kits. I'll now walk through the key considerations to help you determine which type or types of tests make sense for your pharmacy to offer. There are a number of regulatory considerations for determining which type of test your pharmacy should offer. The first is whether pharmacists are able to offer all these different types of COVID-19 tests in Washington State based on our scope of practice. The short and sweet answer is yes. Pharmacists are able to offer specimen collection in partnership with a laboratory, point-of-care antigen testing, or home test kits. In May 2020, the U.S. Department of Health and Human Services issued a declaration under the Public Readiness and Emergency Preparedness Act, also called the PrEP Act, providing guidance authorizing licensed pharmacists to order and administer COVID-19 tests. This allowed for pharmacists to qualify as covered persons under the PrEP Act so that they may receive immunity with respect to all claims for loss caused by, arising out of, relating to, or resulting from the administration or use of FDA-authorized COVID-19 tests. This is important because all currently available COVID-19 tests have been issued an emergency use authorization, or EUA, by the Food and Drug Administration, which means they have not received a full FDA review or approval. The Pharmacy Quality Assurance Commission, or PQAC, has clarified a number of issues as they relate to licensed pharmacists in Washington State ordering, administering, and reporting results of COVID-19 tests to patients. In terms of screening, a pharmacist or pharmacy intern, under the supervision of a pharmacist, may screen patients for eligibility for COVID-19 testing. It is not within the scope of practice for a pharmacy technician to perform discretionary functions. A pharmacy technician may only perform screening elements to the extent that they could be described as non-discretionary functions. If the screening includes any form of discretionary decision-making, these decisions must be reserved for the pharmacist or pharmacy intern. Pharmacy assistants cannot conduct screening. In terms of ordering, PQAC will not take enforcement action against pharmacists who order COVID-19 tests consistent with the guidance issued by the United States Department of Health and Human Services. PQAC will be maintaining this position until it is withdrawn at an open public meeting or Governor Jay Inslee issues a proclamation terminating the state of emergency. In terms of administration, pharmacists may administer COVID-19 tests. Finally, and importantly, pharmacists may not diagnose a patient with COVID-19 unless diagnosis is permitted under the terms of a collaborative drug therapy agreement. In the absence of a CDTA, a pharmacist may only provide the results of the COVID-19 test in terms of whether it was positive or negative and recommend the patient contact their primary healthcare provider. This is most applicable to point-of-care antigen testing. If you are considering offering point-of-care antigen testing, you may want to consider pursuing a CDTA. The next consideration is whether your pharmacists have their National Provider Identifier, also known as NPI. An NPI is a unique 10-digit identification number for covered healthcare providers that is required for administrative and financial transactions adopted under the Health Insurance Portability and Accountability Act, or HIPAA. As part of HIPAA, providers must share their NPI with other providers and health plans or any entity that may need to utilize the NPI for billing. Although the Centers for Medicare and Medicaid does not recognize pharmacists as providers at this time, some health plans require pharmacists to have an NPI for providing care to patients. This may include ordering and interpreting tests for COVID-19, so we suggest pharmacists get an NPI if they do not have one, especially because it's incredibly easy to do. The easiest way to apply for an NPI is to apply online using the National Plan and Provider Enumeration System. The link to this website is provided on the slide. You will also want to think about liability. As I mentioned on the previous slide, the PrEP Act conveys immunity to providers, including pharmacists, for all claims for loss caused by, arising out of, relating to, or resulting from the administration or the use of medications or devices related to COVID-19 for the duration and state of the current emergency declaration. This protection applies to medications, tests, and devices issued emergency use authorizations by the FDA. Therefore, pharmacists, technicians, and pharmacies have a reasonable expectation of immunity with regard to offering COVID-19 testing. For this protection, users must follow the most current package insert and instructions for the test, device, or medication being used. Protections do not apply if harm was caused by an act or omission of willful or criminal misconduct, gross negligence, reckless misconduct, or a conscious flagrant indifference to the rights or safety of the individual harmed, or if rendered under the influence of alcohol or an intoxicating drug. Although pharmacies carry their own liability insurance for their staff and business, we strongly encourage pharmacists to carry their own personal liability insurance. Although carrying personal liability insurance is not required to provide COVID-19 testing, we recommend it to pharmacists in order to protect their personal interests as it pertains to practice, because liability claims against a provider can endanger their personal savings and assets. The next regulatory consideration is whether your pharmacy has a CLIA certificate of waiver. The Clinical Laboratory Improvement Amendments of 1988, or CLIA, established quality standards for laboratory testing to ensure the accuracy, reliability, and timeliness of patient test results. CLIA requires that any facility examining human specimens for diagnosis, prevention, treatment of a disease, or for the assessment of health must register with the Centers for Medicare and Medicaid Services and obtain CLIA certification. Under CLIA, a laboratory is defined as a facility that performs applicable testing on materials derived from the human body for the purpose of providing information for the diagnosis, prevention, or treatment of any disease or impairment of or assessment of the health of human beings. This includes pharmacies providing testing. CLIA also defines CLIA-waived tests as simple laboratory examinations and procedures that have an insignificant risk of erroneous result. Therefore, pharmacies must procure a CLIA certificate of waiver to perform any CLIA-waived tests, including CLIA-waived COVID-19 tests. This is very important if you are considering offering point-of-care antigen testing, as you will need a CLIA certificate of waiver to do so. If you already have a CLIA certificate of waiver, you need to update it to include COVID-19 testing. If you are considering offering specimen collection in partnership with a laboratory, you will not need to obtain a CLIA certificate of waiver for your pharmacy, as you will be performing the specimen collection under the laboratory's license. A CLIA certificate of waiver is also not needed for dispensing home test kits. In Washington State, we have a unique process for obtaining a CLIA certificate of waiver. Pharmacies need to obtain their certificate of waiver from the Washington State Department of Health. The application website is provided on the slide. Note that pharmacies must be able to meet the requirements for reporting notifiable conditions in the Washington Disease Reporting System to obtain a certification of waiver in Washington State. An alternative would be contracting with a healthcare provider who orders tests and reports via the Washington Disease Reporting System to comply with Washington State's requirements for a medical test site. The final regulatory consideration is related to emergency use authorizations, or EUAs. Under the PrEP Act for the declared COVID-19 pandemic, the FDA is authorized to use its EUA authority to allow for use of unapproved medical products to diagnose, treat, or prevent serious disease when certain criteria are met, including that there are no adequate, approved, and available alternatives. Medications and devices approved under an EUA have not received a full FDA review or approval. The FDA reviews information by the manufacturer, including in vitro studies and preclinical testing data, in its consideration to issue an EUA for a device. Once the declared emergency is terminated, the EUAs are no longer in effect. You will need to confirm that any test you are offering at your pharmacy has EUA from the FDA. The FDA's Coronavirus Disease 2019 Emergency Use Authorizations for Medical Devices page lists all devices that have an EUA for their use. This website is provided on the slide. The tests themselves are categorized by the FDA and the EUA for use in one or more of the following settings: laboratories certified under CLIA that meet the requirements to perform high complexity tests, laboratories certified under CLIA that meet the requirements to perform moderate complexity tests, and WAVE laboratories, that is, patient care settings operating under a CLIA certificate of waiver, such as pharmacies. If you are performing specimen collection in partnership with a lab, you should be offering a test with an EUA for high and/or medium complexity settings. If you are performing point-of-care antigen testing, you will be offering a WAVE test. WAVE tests are defined as simple laboratory examinations and procedures that have an insignificant risk of erroneous result. The FDA determines which tests meet these criteria when it reviews manufacturers' applications for test system waiver. Tests that will be run in the pharmacy must be authorized for the CLIA waived setting. You can verify this by checking the list of test kit manufacturers with an FDA EUA. There will be a W in the column titled Authorized Settings for any test, regardless of type, to be performed in a CLIA waived laboratory. The authorized setting for home test kits is listed as not applicable or NA or left blank on the FDA website. Lastly and importantly, if you are going to be conducting general screening, meaning you are going to be testing individuals for current SARS-CoV-2 infection who do not qualify for testing based on the CDC's recommendations, you need to ensure the test you are using is authorized for screening in its EUA. You also need to consider where you are going to be conducting testing and the physical space you have available. The first step is to determine if outdoor or indoor testing is appropriate. As of when this presentation was recorded, outdoor testing is preferred to reduce transmission risk for specimen collection in partnership with a lab and point-of-care antigen testing. Pros of outdoor testing include reduced exposure to pharmacy staff and patients, reduced need for cleaning surfaces, especially if the patient remains in their vehicle, the ability to schedule more patients over a shorter period of time, and minimal to no impact on traditional pharmacy services indoors, as the testing will be occurring in a separate space. Cons include that a large amount of outdoor space is needed for traffic flow. You need to consider weather elements and their impact on supplies, patients, and pharmacy personnel. lack of access to hand washing and computers, and the need for additional staff. Outdoor testing setup should have enough space to avoid congestion and bottlenecks in workflow, including avoiding backup onto adjacent roads. There should be sufficient space to allow vehicles to wait in a queue, especially if you are not going to use an appointment-based model. Traffic flow also needs to be clearly marked using cone signs or visual cue cards or other available marking supplies. In designing your traffic flow, you will need to consider how to maintain 6 feet of space between pharmacy staff and patients to decrease the risk of SARS-CoV-2 transmission. This will also impact the personal protective equipment requirements, which we'll discuss in more detail in a few minutes. The supplies needed for testing should be laid out in a manner that is easily accessible during testing and protected from weather elements, including extreme temperatures and rain or snow. Supplies include a portable table, portable tent or canopy, cleaning wipes for table and clipboards, ink pens, biohazard waste bags, traditional garbage bags, nasal swabs, test device, and tissues to offer the patient after the test. Portable hand washing stations are ideal to allow staff to cleanse their hands. Hand sanitizer may be used at all stations before putting on gloves and after taking them off if portable hand washing stations are not available, or in addition to hand washing as a means of additional cleaning. The bottom line is that it's really important to spend the time thinking through every step of your testing workflow in detail from screening to result through the lens of minimizing risk of SARS-CoV-2 transmission. We recognize that not all pharmacies have the physical space to offer outdoor testing. You might consider partnering and offering testing off-site in order to use an outdoor model. While indoor testing for current infection is not recommended, we want to cover consideration for this model for completeness. In an indoor model, pre-screening is important to help reduce the chances of anyone with active symptoms from entering the pharmacy. Each patient should be questioned for symptoms of an active COVID-19 infection, as well as have their temperature taken using a touch-free thermometer to minimize contamination. You will also want to consider how you might separate indoor testing from pharmacy workflow to minimize impact to other patients or customers entering the pharmacy. This should include using a private or semi-private area where testing and counseling can occur. This area should have easy access to all necessary supplies and cleaning materials, including a hand washing station. There will be increased cleaning needs and personal protective equipment requirements compared to an outdoor testing model, including cleaning the testing area before and after each patient. Offering home collection kits may be a good option if your pharmacy does not have sufficient space for outdoor testing. Home collection kits are authorized for home self-collection, so testing would not be happening in the pharmacy. These kits could be dispensed and sold via drive-thrus to avoid potentially infectious individuals from entering the pharmacy. You will also need to think about which staff will be performing or overseeing the testing. When possible, staff at higher risk for severe COVID-19 illness because of age and/or underlying medical conditions should be excluded from testing sites. If they are at testing sites, it's best to utilize them in ways that limit their exposure to patients and respiratory droplets. These roles may include recording test results, directing traffic, billing, or data entry. We do recommend separating testing and dispensing workflow to minimize risk of transmission to staff and patients. This does require additional staff. You will also want to think about the time requirements of performing these different tests because they require additional staff. Home test kits require the least amount of time and should not actually require additional staff since they are dispensed in normal workflow. Specimen collection in partnership with a lab also requires less time, whereas point-of-care antigen testing takes more time because you are running the test on site. With point-of-care testing, you will also want to think about whether you will have the patients wait on site for their results or whether you will contact them later with their results. The next consideration is patient education. In Washington State, we do not have any specific patient education requirements from a legal or regulatory perspective like pharmacists in other states do. like New York State as one example. However, there are clearly established patient education best practices we strongly encourage you to incorporate into your testing workflow. If you are offering specimen collection in partnership with a lab or home test kits, you are not going to be communicating test results to the patient. However, best practice is to counsel the patient to remain in quarantine until they receive their test results, especially if they are symptomatic or have been in close contact with a confirmed case, to prevent asymptomatic or pre-symptomatic transmission. We have seen a large number of cases that have resulted from individuals not remaining in quarantine while waiting for test results, which makes this education point incredibly important. It's so important that CMS has established evaluation and management codes to reimburse providers who are eligible to bill CMS for counseling services, no matter where the test is administered, including doctor's offices, urgent care clinics, hospital and drive-through, or pharmacy test sites. You can visit the website provided on the slide to learn more about this opportunity. If you are offering point-of-care antigen testing, you are going to be communicating the test results to the patients. Recall, pharmacists in Washington State can only diagnose COVID-19 via a CDTA. However, you may communicate the test results, whether positive or negative, to patients without a CDTA. The CDC has developed guidance for counseling on COVID-19 test results. If a patient tests positive, you should then counsel on what protective steps they need to take to prevent others from getting sick. This includes staying home except to get medical care, separating themselves from other people, monitoring symptoms, wearing face masks, covering coughs and sneezes, cleaning hands often, avoiding sharing personal household items, and cleaning all high-touch surfaces daily. You should also provide counseling for when it is okay to be around others again. Patients who had COVID-19 and experienced symptoms can be around others after 24 hours with no fever, once respiratory symptoms have improved and 10 days have passed since symptom onset. Patients who had asymptomatic COVID-19 can be around others once 10 days have passed since their COVID-19 test. If a patient tests negative, it's important to counsel them that the negative result means they were not infected at the time the sample was collected. A negative test result only means that a patient did not have COVID-19 at the time of testing. So you should provide counseling on how a patient should continue to protect themselves and others. The Coronavirus Aid, Relief, and Economic Security, or CARES Act, requires COVID-19 testing sites to report every COVID-19 test administered, including tests for current and past infection and positive and negative results, to the appropriate state or local public health department based on the individual's residence. The information that must be reported has been outlined at the federal level. Complete laboratory data must include a number of elements, including information on the test and information on the patient. How this information should be reported is outlined at the state or local level. In Washington State, the Board of Health's Emergency Rule, WAC 246-101-017, outlines additional data elements that are required to be reported and how COVID-19 tests need to be reported in our state. In comparison to the federal requirements, our state's emergency rules requires the patient's emergency contact phone number, more granular reporting of race and ethnicity, and preferred language. In Washington State, laboratories need to report to the Department of Health, who then shares the information with the applicable local health jurisdiction and CDC. There are 2 electronic options for reporting results to DOH in production and 1 under development, including electronic lab reporting, national flat file, and electronic case reporting. You can visit the website on the slide to learn more about each of these options. If you are performing specimen collection in partnership with a lab, the pharmacy is not responsible for reporting. Rather, the lab is responsible for reporting. The pharmacy is responsible for reporting if you are offering point-of-care antigen testing, since you are performing the test under your own CLIA certificate of waiver. In this instance, you will need to think about how you will collect all the required data elements and transmit them to the Department of Health. There are a number of commercially available systems that can help you collect the required information as part of a screening, consent, and appointment-based process. These systems may also have the ability to transmit the information to the DOH. The last consideration to weigh is payment. There are a number of different ways you can be paid depending on whether you have a CLIA waiver and are partnering in order to provide testing. In general, payment for COVID-19 testing varies depending on whether the patient receiving the test is insured by Medicare, Medicaid, or private insurance, or is uninsured, and whether a payer recognizes the pharmacy or pharmacist for payment. If you are providing testing without a CLIA certificate of waiver, meaning you are not providing point-of-care testing, the opportunity for collecting payment is limited. It requires the pharmacy to have a contract with a Medicare-enrolled laboratory or provider, collect cash from the patient. The patient could also use FSA or HSA, or participate in an employer or public health contract for specimen collection. To go into more detail on each, pharmacies can contract with Medicare high-throughput laboratories to provide specimen collection services. Pharmacists can be reimbursed on the terms of their contract with the laboratory. The American Clinical Laboratory Association has a list of member laboratories performing tests. Where possible, contract with the lab to be invoiced for tests performed and price the service accordingly. This arrangement avoids surprise bills from the labs. Pharmacists can also contract with a physician. Pharmacists' basic clinical services may be covered through a contract with a Medicare-enrolled provider in accordance with scope of practice and state law. These services may include symptom and exposure assessment and specimen collection. Since pharmacists are not considered providers who can bill for services under Medicare, the pharmacist must be paid under an incident to physician services arrangement. This is an agreed upon financial relationship in which the physician or other qualified non-physician practitioner bills Medicare for the services provided by the pharmacist and then reimburses the pharmacist under the terms of the financial relationship. CMS has established that Evaluation and Management Services CPT code 99211 can be used to bill for testing related to services provided by clinical staff, such as pharmacists, to new and established patients during the public health emergency. Note that in an incident to physician services arrangement, the pharmacist is required to be directly supervised by the physician or non-physician provider, which requires the pharmacist to practice within the physician or non-physician provider's office. During the public health emergency, however, this requirement has been relaxed. Rather than direct supervision, the physician or non-physician provider must at least be immediately available using real-time audio and visual technology. Additionally, COVID-19 assessment, including specimen collection, is HSA and FSA eligible. Provide patients with a summary of the service provided and price for their tax records. Finally, pharmacies may offer a contract with an employer for COVID-19 assessment and specimen collection at the workplace pharmacy or other testing site, or participate in public-private partnerships or similar programs to collect specimens for testing. There are also a number of ways to be paid for point-of-care antigen testing. The CMS has described payment opportunities for conducting a COVID-19 test and for some testing-related services. Medicare will pay pharmacies enrolled as an independent clinical laboratory for COVID-19 tests performed by pharmacists. CMS has also described several opportunities for pharmacists to contract with a Medicare provider for COVID-19 testing-related services and be paid by that provider, which I just discussed on the previous slide. With this payment option, pharmacists are not directly paid by CMS. To offer testing for COVID-19 at the point of care, pharmacies with a CLIA certificate of waiver should enroll as an independent clinical laboratory to collect payment for testing. A CMS 855B enrollment application must be completed and sent to the Medicare Administrative Contractor, or MAC, serving your geographic area. During the period of the public health emergency, CMS has waived Medicare enrollment fees. Pharmacies will be assigned a Medicare provider number called a Provider Transaction Access Number, or PTAN. Using the PTAN assigned to the pharmacy for purposes of COVID-19 testing, the pharmacy can bill their local MAC for COVID-19 tests using the appropriate diagnosis and billing codes. Pharmacies will likely need to contract with an intermediary company that can convert NCPDP claims to medical claims for submission to the MAC, because Medicare payment for COVID-19 tests occurs through the medical benefit. Note that pharmacies can also conduct and receive payment for influenza and/or RSV if the tests are performed concurrently with a COVID-19 test and allowed by state law. Additionally, pharmacists can also receive payment if contracted and credentialed with a non-CMS payer. If you are, you will want to check what services are covered and what the parameters are for coverage. Finally, pharmacies can try submitting a claim to the patient's prescription benefit. The claim will have a product identifier for the test plus a professional service code. If you plan to pursue payment from the Centers for Medicare or Medicaid, it is important to know that CMS states there's no beneficiary cost sharing for COVID-19 testing and services during the public health emergency. The U.S. Department of Health and Human Services will provide claims reimbursement to healthcare providers generally at Medicare rates for testing uninsured individuals for COVID-19 and treating uninsured individuals with a COVID-19 diagnosis. Additional information can be found at the website provided on the slide.
Now we'll talk about steps your pharmacy should take when deciding how you will plan to collect specimens for COVID-19 testing. We'll spend the last bit of this section talking about these important considerations and steps. First, consider whether your pharmacist and interns are trained in the appropriate specimen collection techniques. This could help you determine whether your pharmacy staff should perform specimen collection or observed specimen collection. Additionally, it is essential to be familiar with the manufacturer's instructions prior to performing any test. Pharmacies holding a certificate of waiver must follow the current manufacturer's instructions for the waived test systems that are used for patient testing. It is the pharmacy's responsibility to ensure the most current versions of the manufacturer's instructions are being followed. To meet the regulatory requirements, pharmacies must comply with the manufacturer's requirements for testing. The Centers for Medicare and Medicaid Services, or CMS, also encourages pharmacies to comply with the manufacturer's recommendations for testing. It is also important to consider your access to personal protective equipment. There are different PPE needs depending on whether your personnel will be performing specimen collection or observing self-collection, with observing self-collection requiring less PPE. If you will be observing specimen collection, you should maintain a 6-foot separation between symptomatic or exposed patients and pharmacy staff. When a 6-foot distance is maintained, especially when outside, a face mask and gloves is adequate PPE. Pharmacies need to plan to have enough face masks and gloves on hand to fulfill the test volumes they anticipate. If pharmacy staff will be administering swabs, or a 6-foot distance between patients and staff cannot be maintained, PPE should consist of an N95 respirator or higher, a face shield, gown, and gloves. Staff who are required to wear a respirator for their job must be fit tested according to OSHA guidelines. There are mobile fit testing companies that can help pharmacies meet this requirement. Additionally, pharmacy staff should be instructed how to properly put on and take off PPE. The CDC Using PPE website has a training video that should be viewed by all staff prior to utilizing PPE. Additionally, even when the testing site has been set up to maintain a 6-foot distance, it is a best practice to have a few sets of complete PPE available, including respirator, gown, face shield, and gloves, and staff trained to use them for emergencies. If a patient presenting for testing is hypoxic or needs medical care, this PPE will be necessary for response. Finally, your pharmacy needs to take into account operational considerations when deciding how to implement COVID-19 testing. First is identifying how specimens will be transferred to the laboratory. You'll need to consider if you will be performing specimen collection in partnership with the lab. Things you should ask yourself includes, how will specimens get to the lab? What are the pickup times of different vendors? How might this impact when you are able to offer testing in order to get it to the lab for processing in a timely manner? Also, is it important to negotiate this while establishing a contract with labs? You'll also need to consider quality control processes. This is important whether your pharmacy plans to do specimen collection in partnership with a lab or point of care testing. Tests are only as accurate as how well the specimen was collected. Therefore, it is important to implement quality control processes, whether considering specimen collection in partnership with a lab or point of care testing, and especially if a pharmacy staff are going to be performing specimen collection themselves. Pharmacies must also follow the manufacturer's quality control and test performance requirements for the test that they are offering. Finally, you'll also have to consider biomedical waste disposal. Proper disposal of biomedical waste generated from the COVID-19 testing is critical and necessary due to the infectious nature of coronavirus. So this concludes our overview of COVID-19 testing in pharmacies and considerations you should make when implementing a program in your pharmacy. To recap, there are several kinds of FDA authorized COVID-19 tests available, which fall into two categories: tests that look for current infections and tests that look for past infections. Only tests that look for current infections can be considered diagnostic, like the molecular PCR test or certain types of rapid antigen tests. Certain groups of people should be prioritized for testing based on risk: those who are presenting symptoms of active SARS-CoV-2 infection, those who have come into contact with people who have SARS-CoV-2, and those who are referred for testing by a healthcare provider. Pharmacies can participate in COVID-19 testing programs through three means. The first are federal programs run by the U.S. Department of Health and Human Services. These programs focus on specimen collection. The second way your pharmacy can participate in testing is through the Washington Department of Health. And finally, your pharmacy can offer tests through point of sales as long as the tests you're offering are FDA authorized. Lastly, we went over several considerations your pharmacy should make when setting up a COVID-19 testing program, like regulatory considerations, patient education, availability and procurement of PPE, and operational considerations.
In closing, this slide provides a number of helpful resources. We would like to thank you for watching our presentation and invite you to reach out to us via email with any questions.